when our babies come to us, that they come to us from the spirit world, and that we have been chosen to care for this baby when they come here to Mother Earth. And so I think that a provider needs to know that the child is not in physical form at this time from the spirit. So the spirit comes, and when the baby's born, then that's when the spirit is also born. And that it's not all medicine, right? And that there's spiritual significance to birthing a child. And I think when our providers that we encounter, they see it as Western medicine. They don't see it as it's science, right? And it's not about the spiritual significance that our babies bring to Earthside. So I think it's important to know how to ask a question and which questions to ask, and you're not going to know that unless you get to know the patient. And so it's kind of the chicken or the egg concept, right? So you can't get to know your patient unless you ask questions. And your patient is not going to get to know you unless they ask you questions. But I think one of the things that is really helpful in that relationship is your reputation. So if you have a reputation of being a helpful, kind, caring, compassionate person, then the relationship is going to be nurtured quicker, and it can probably be even longer standing, in the community with the people. But we always know that, that relationship always comes first, and that first emotion that's tied to that relationship is love. So being kind and caring is really important, and not being too assertive, but kind of laid back and just kind of letting the relationship flow. Inviting parents to participate and not assuming that, it's necessary for them to participate, but offering the opportunity. With our group prenatal class, the moms and their baby's dad are invited to participate in the group prenatal, and they can make a choice whether they want to participate or not. And I think with the growth of our group prenatal classes over the last year, we're beginning to see how receptive the moms and the dads are with coming to the group prenatal class and getting the information that they otherwise wouldn't get in just a regular appointment. Traditionally, we were in our own tribal communities. And so all of our teachings and all of that knowledge that we obtained was specifically held within our community. And it was specific to who we are as tribal people. And then came, 100, 500 years later, came other races and other structures, right, institutional structures within the community that we had to now adapt to and adopt. When we talk about navigating, in a lot of times for us as tribal people, it always seems that we are responsible now for having to know and understand how do we navigate in this new world other than just in our tribal community, and not reciprocal, right, back and forth, that People come into our community not knowing our history, our language, our culture, our social innuendos. They just expect us to know what they're going to provide to us. So a lot of times it's viewed as code switching. So when I'm with my peers, I can speak a little differently, whereas when I'm as a professional with my peers, then I speak differently with them, or I conduct myself a little bit differently with them based on who I'm with and what arena I'm in professionally. The primary thing is to really make sure that the care that you're providing is explained in a language that is understood by the patient, and that they're not using that medical terminology. And if they have to use the medical terminology, to be able to explain it in layman's terms. And I think that in itself really helps to build that trust between the provider and the patient, and not the patient having to try to figure that out for themselves when they may not ever have any experience with a condition called preeclampsia, which is common in pregnant women. And so if you're using those terms, that you're explaining them, and if you are treating that condition, that you're actually asking for permission and then proceeding with the options for treatment.